Hello, this is Dr. Karthik from Medlife. Today we will understand about the common respiratory diseases that we encounter typically during winter season. Generally, as you would know, the common issues are common cough and cold. Many people develop sinusitis. There can be pain over here in the forehead, pain on either side of the nose. Typically, there is an inflammation of the sinuses which are there. So it can be common cough, cold or flu, or it can also kind of further go deep down our respiratory system and affect the lungs, and therefore the patient can develop something called wheezing. It's a noisy whistling kind of a sound that comes. So these are patients where the respiratory passages or the tubes become narrower, and this is because of the allergic condition that the patients have, and this causes a whistling sound. Second, patients may develop this condition called pneumonia, where there is infection in the lungs which needs to be managed immediately. And third, the patients may also develop something called as chronic obstructive pulmonary disease, chronic obstructive lung disease, where the air passages may get restricted, contracted or obstructed, which causes difficulty in breathing, and it can also lead to infection and other problems which can be potentially fatal at times. It needs to be treated immediately if the patient becomes breathless. So therefore, what are the common causes that leads to some of these conditions? So one, patients that have asthma or wheezing typically tend to have an allergic condition. This allergic condition is created when patients who are allergic to pollen, dust, mites. Some people are allergic to dog hair. So these kind of people, who are allergic to dust, pollen, dog hair, etc. So they develop this histamine in the human body. It's an anti-allergy. It's a reaction of the body to respond to allergy. So histamine basically causes an allergic reaction, and that leads to constriction of the air passages, and the patient finds it difficult to breathe. And that is when the doctor advises medicine called antihistamine, which actually reduces the levels of histamine or the allergy causing agent in the body. The air passages become normal in size, and the patient is able to breathe normal again. The second important thing is if we observe our nose and then the respiratory passages carefully, we have a mucus layer or a thick slimy layer. So this mucus layer is actually protective in nature. It actually stops all the dust that enters when we breathe in air and breathe out air, and it actually removes the dust constantly. But when there is excessive irritation or excessive, disease-causing organism like bacteria or fungus that gets in as a part of our breathing, then what happens is the amount of mucus produced in the air passages actually increases. This mucus in turn can actually lead to blockage of the respiratory passages or the air pipe, and that can lead to difficulty in breathing. Moreover, if mucus accumulates in the air passages over a long period of time, it can get infected, and that leads to lung infections, which needs to be immediately addressed and treated. So therefore, common conditions of the respiratory illness are generally mediated by allergic conditions because of dust, mite, and sometimes also because of cold weather. And second one are mostly the bacterial or viral infections that lead to increased mucus production, for which you need to treat the respiratory condition with proper medications. So these are some of the common respiratory illnesses to watch out for in the winter season. So how can we avoid it? For patients with an allergic tendency, it's always advisable that you avoid the allergy causing material. So keep away from dust, mite, dog hair, cold weather as far as possible. Cover your nose. Do not expose your nose and ears to cold weather. It's always cover your nose. Wear a jacket, wear a muffler, cover the body parts which will trigger an allergic condition or an asthmatic attack or a wheezing attack. Second, for patients who are prone to infections, it's always important that again, stay warm, wear warm clothes. Avoid exposure to people that have infections. Always when you're coughing or sneezing, close your mouth so that you don't spread the infection to the others. and always make sure that you wash your hands well, because if you have sneezed and if you have actually covered your nose and mouth with the hand, the viruses may still be lying on the palm of your hands. So always wash your hands before you give a handshake, so that you do not pass on the pathogens to others. So these are some of the common, I would say, preventive measures and care measures that one can take to take care of common respiratory illnesses that can occur during winters. Hope you like this video. Subscribe to our YouTube channel and look forward to more such videos.